Good morning. I'm Dr. Hughes. What brings you in today?
Morning, doctor. I've had this pain in my right hip for years now, but lately it's really been getting worse. I've even had to start using a walking stick to get around. It's affecting everything I do, and I'm starting to worry what this might mean.
I can understand your concern. Let's see how I can help. First of all, you're not alone. Hip pain like yours is quite common in people over 65. Do you mind if I ask a few more questions?
Not at all, but I was wondering what could be causing this pain. Could it be arthritis?
That's a very reasonable question. Yes, osteoarthritis is actually the most likely cause at your age. Other possibilities include bursitis, tendinitis, or even pain referred from your back. But arthritis tends to be the most common cause, especially when it's been developing gradually over the years.
That makes sense. But why is it getting worse all of a sudden?
Good question. Sometimes symptoms worsen because the joint continues to wear down over time. If the underlying issue isn't treated, the joint can become stiffer, less mobile, and more inflamed, leading to more pain and difficulty with movement.
Is this sort of problem common?
Yes, absolutely. Many people over the age of 65 experience similar symptoms. You're definitely not alone in this.
All right, so what needs to be done now to find out exactly what's going on?
We'll start with a physical examination and then do an X-ray of your hip. That will give us a clear picture of what's happening inside the joint and help confirm whether it's arthritis or something else.
And what kind of treatment might I need?
That really depends on the diagnosis. But if it is arthritis, we have several options. Conservative treatments include weight management, modifying physical activity, using pain relievers like paracetamol or anti-inflammatory medications, and physiotherapy. If these don't provide enough relief, we might refer you to a specialist to discuss further options like a joint injection or even a hip replacement.
I see. And what happens after the tests?
After your X-ray, we'll review the results together. Then, we'll come up with a treatment plan tailored to your condition and needs. We'll also monitor your progress and adjust the treatment if needed.
Thank you, doctor. That really puts my mind at ease.
You're welcome. I'll arrange the examination and X-ray for you now, and we'll take it from there, one step at a time.
Good morning, I'm Dr. Lewis. What brings you in today?
Morning, doctor. I'm really swamped with work right now, but something happened a couple of days ago that I can't ignore. I fainted and blacked out for a couple of minutes. This actually happened once before, about 3 months ago. I was hoping it was a one-off, but now I'm getting concerned.
Thank you for sharing that. I can understand why you'd be worried. Fainting, or what we call syncope, can have many causes. I'd like to ask a few questions and then run some tests to get to the bottom of this. Do you remember exactly what you were doing before you fainted?
Not much really. Both times I was just standing, and then suddenly I lost consciousness. I was out for a minute or two each time.
Were there any witnesses either time?
No, unfortunately not. I was alone both times, so I can't really say what happened exactly.
All right. Since no one saw what happened, and we're unsure whether it was a faint, a seizure, or something else, we'll need to investigate further. I'd like to start by doing an ECG here today and some blood tests. I'll also arrange a CT scan of your head to rule out anything serious.
That sounds a bit intense. What do you think is wrong with me?
Honestly, it's hard to say without those test results. But 2 fainting episodes in 3 months do warrant a closer look. One possibility is a heart rhythm problem, but we also want to rule out neurological causes, like seizures. so I'd like you to see a neurologist as well.
I understand, but I really can't take time off to see a specialist right now. I have major business deals coming up, and I need to be working full-time for at least the next 2 weeks.
I completely understand how important your work is, and I don't want to cause unnecessary alarm. But it's essential we rule out any serious cause. Seeing a neurologist is just a precaution, but it's an important one. They'll do a thorough assessment, which might include an EEG to check your brain's electrical activity.
I see. Well, I guess I could try to book it in 2 weeks.
Please try to book the earliest appointment possible. Even if you can't see them immediately, starting the process now means we're not delaying your care. Also, I strongly advise you not to drive until we know more. If another blackout happens while you're driving, it could be very dangerous, for you and others. Your car insurance might not even cover you in that event.
I hadn't thought about that. Not driving will make things tricky, but I suppose you're right. I can arrange alternative transport for now.
That's a wise decision. We'll start with the ECG and blood tests today. I'll also refer you for a CT scan and to a neurologist. We'll follow up once we have more information. We'll get to the bottom of this together.
All right, doctor. Thanks for taking this seriously. I appreciate it.
You're very welcome. Let's get started with the tests.